You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Thank you very much for staying tuned. Welcome back to the fourth part of this session. Thank you, our sponsors, Ministry of Health and Camelin Men's Collection. In this segment, we are going to talk about complications and prevention of these illnesses. If you have any questions, the numbers are on your screen. You can also subscribe onto our YouTube channel, the Doc Talk Show. So Dr. Alex will take us through the complications.
Okay, thank you very much. As I've mentioned in the beginning, is cause that conjunctivitis, that inflammation of the conjunctiva. And normally, when there is an inflammation, sometimes there is ulceration, that's some wounds develop on the conjunctiva, and when it happens, there is secondary infection. There is infection by either the bacteria or the viruses or the fungi. And this one, once it happens, it brings in again another problem where we get discharges from the eye, which is yellowish, that's pus-like, or it can be greenish, depending on the type of bacteria or which has invaded the eye again. When such a thing happens, there is a superimposed infection onto the allergy, which primarily exists. There is also a complication. There is reduction in sight. I have mentioned this because the eyes start fearing the light. Because of the photophobia, now the sight will be reduced, and if it recurs several times, this can affect the overall vision of the child. And in most cases, if it is not treated, it can cause blindness or disability. One can develop low vision or permanently get blind. So those are the things which we fight. Although in some children can outgrow these allergies and they get complete remission. That is, they get cured as they grow older. But that only happens if the child has been well treated. But once neglected, the reverse is true. So I encourage all parents, whenever you get a child with such problems, don't give up. It is a struggle which you need to take on for a long time until that child either overgrows the allergy, or you can control it to some extent that the sight is maintained. I've talked of raised eye pressure that may develop. That one normally comes if one overuses the steroid eye drops. Irrational use of steroid eye drops can bring about glaucoma, and that one, it is an automatic, sure way of getting blind. Because once you develop glaucoma, for sure, you have nothing, because it causes irreversible blindness. So let us avoid that kind of behavior, treating ourselves with drugs we don't understand well. Another caution which I can give is not to use herbal medicines, because those herbal drugs contain different things which we don't know, which are not even yet tested. We don't know how they work, and in most cases they harm the eyes, because some of these chemicals in the herbs, either they are toxic, they have acid or alkalis, which is so corrosive to the eye. Some of them, they have the fungi that grow on the vegetative matter. So once introduced in the eye, they can cause very complicated infection that cannot be easily treated. Those complications that come with treatment can be avoided if we seek the right treatment from the health workers.
Thank you very much, Dr. Alex. So I'll talk about the management, the complications that we find in colds, and the prevention. So the commonest complications in these colds is the middle ear infection, what we call otitis media. So usually we find mothers usually come back to us after about 2 weeks when the child has had cough and flu, and they come to us saying maybe the child might be having fevers, a few children might be tugging the ear, or what we call pulling the ear, or some children are just screaming and crying endlessly. So when they come to the hospital, mostly we want to check the children's ears to see. We usually ask the mother, has the child been having cough and flu? And the answer is usually yes. So when we check the ear, we find that it has got an infection. So that is one of the commonest causes of the middle ear infection. And the other complications that we may go into are things like sinusitis, which is inflammation in the sinuses. Because of the flu and cough that have been there, they could cause this inflammation. And then the other big complication is pneumonia, the mother's biggest fear, and pneumonia. This is common in especially children who did not receive our vaccines. So we encourage mothers, please take all your children for vaccination, because the government has provided these vaccines free of charge in all health facilities. So we encourage all parents to make sure that their children are vaccinated. When vaccines were introduced in this country, the rates of pneumonia went down, and we really saw this on the wards where we treat the children. So we highly encourage mothers to ensure that their children are vaccinated. In the cases of vaccinated children, when they develop these pneumonias, they are not so severe as the children who are not vaccinated. Unfortunately, most of the children who don't get vaccines may die of the pneumonia, and most of them do die. However, in our vaccinated children, when they get a complication of pneumonia and we deal with it very fast, they usually survive and they're treated as fast. But what are we saying? We shouldn't let our children have coughs and flus unattended to. Like most mothers will say, it will pass. No, we shouldn't, because we might get into these complications such as pneumonia. The other complication that a child might develop might be asthma. The child might develop wheezing even in the absence of allergies. So when you come to so it's very important to come to hospital, because the healthcare worker will pick up on some of these complications that you may not be able to pick up while at home. So we encourage mothers to seek medical help whenever the child is sick. Avoid over-the-counter use of drugs. Some of the preventive methods that we can use to prevent these common colds, like we had said earlier, hand washing. Hand washing is a very simple thing, but most people don't find it easy to do. So we shall continue singing the song of hand washing, hand hygiene. Wash your hands. Encourage your children to wash their hands every now and again. Wash your hands, because it prevents very many diseases. And the other things we can do is have a clean and disinfection of the environment. This one goes to the daycare people, providers. Ensure that the toys are disinfected and cleaned, and keep the environment clean. We can also encourage our children to cover their mouths while they cough. That's the other thing. And remember, whenever we tell our children something, they pick it up and they keep it to them. The other thing, we know that in nursery school, our children are always told that sharing is caring. However, we want to encourage them to not to share mostly their bottles, take on the same bottle, because when another child has an infection, it will be easy for the other child to pick it up. The other thing we would say is stay away from the people with colds, but if they're all in the same class, how will they stay away from each other? But if we keep the main things of hand hygiene, washing hands, we will prevent these colds. Thank you very much. Dr. Alex, if you have something else to add, especially with the prevention, you can add as we close up this session.
The most important thing, as I've mentioned in the beginning, it is mainly to avoid what is the trigger of the allergy. Because as a mother, you should be able to know that whenever this child goes in the cold, comes back with this kind of condition. So you try to avoid that. Or you should be able to tell that whenever this child eats fish or eats meat, it develops such symptoms. And those are the things that we should always avoid. Once you avoid the triggers of allergies, then even controlling them or treating will become easy. Because if you don't know what causes the allergy, you may treat, but it will continue coming back again and again. And that one usually discourages the person taking care of the patient, and they end up going for alternative medicine, which is something we mainly discourage. Because as far as eyes are concerned, they are very, very, very delicate. They don't need anything else like alternative medicine, because you'll be instead causing problems to that child.
Mothers, cough and flu is not equal to give of antibiotics. Stop giving children antibiotics when they've developed a cough and flu. Take the child to the health worker, and the health worker will determine what to give the child. Thank you very much.
Thank you so much, Dr. For that that remark. And as I was saying, we also thank our sponsors, Ministry of Health and Cameroon's main collection, for sponsoring this show. For those of you who still have questions, the numbers down there on the screen, please send your questions. We shall be able to answer them.
This message is from the Ministry of Health with support from partners.